record. Lucky yes. Okay, so welcome to the 740-741 Zoom review. What I thought I would do is I'm going to go through like the course outline just a little bit and some minor changes that are probably going to be made later in the course. Some stuff on your manuscripts, what that in-person day is going to look like and what we're thinking. The schedule isn't 100%, but going over what things to look at. And then we'll review info for the first test. And as far as 741, just making sure you're all feeling okay with the use of Typhon, SOAP notes, what to hand in, how much, all that kind of stuff. A little bit about site visits and the clinical time logs. So that's my general outline at this point. As far as, as far as the course outline, just for a little bit of background information, as you probably already figured out at the beginning of the course, Dr. Bucher was teaching this course and resigned from the college the week before class started. So a lot of this stuff, the content, etc., is still the things that he put in. He kindly said that I could use everything that he had put in. So the outline, the syllabus, pretty much stayed the same. The only things that I see that are going to be different, I am going to probably in week 6 or week 7 add a video on cardiology testing, like stress testing, echoes, when to order, what kind to order, that kind of thing. So, and a little bit about each of the different kinds of stress tests, etc., so that you have some idea when you're ordering these things, what the algorithm in your head should be as far as deciding what to order. So that I'm going to put in. And good likelihood the stuff that's in week 9 is from Dr. Johnson. I'm probably going to redo those talks, but the slide content isn't going to markedly change. So as you know, same as in Patho, same as in Pharm and the other classes, the majority of your test content is going to be found on the slides. So use that as your main study point when it comes to the test. The readings, I know that there's now a lot of them are like 1 page or 2 page, but they're supplemental, give you a little bit more information about the subject. So if it's an area you're somewhat weaker in, then maybe you want to read some of the background information. If it's an area that you're used to working in and you feel confident, or you're doing clinical in that area and you're feeling confident, then obviously not as much to study from that perspective. Well, as far as the test itself, since we're looking at outline here, I will tell you that about 1/3 of this test is on the diagnosis and management of DKA. So that section in here on diabetes, DKA, HHNK, like know that content. If you're there's a patient case scenario that you're presented with, and then ask multiple questions about that case scenario. So think about it from that perspective, about the diagnosis about how you would treat. Now you treated and then you got this lab work back. How would you handle that? Management of the inpatient diabetic, as far as like sliding scales, that kind of thing is in there. Those are the biggies. So that's a huge chunk. That's 1/3 of the test. As far as some of this other stuff, to give you some ideas on what to think about. As far as the leading causes of death, there are a couple questions. Know what the leading causes are based on age group of people. So younger people, older people, etc. Immunizations. Who should get immunizations, and and when they should get them. There's some questions on the Pneumovax, and there's also questions about vaccines in general, like the kinds, the live attenuated, the non-live, that kind of thing. And I guess for next year, I'm going to have to add messenger RNA. But that's not an answer to anything because we didn't update it. Some questions on TB, who's at risk for TB, the treatment for TB, meningitis, bacterial versus viral, signs and symptoms and treatment for Lyme disease. So a question regarding necrotizing fasciitis, being able to differentiate dementia versus delirium. And then the oncologic emergencies, being able to identify what the emergency is based on like giving a patient presentation. They have this kind of cancer. They present with A, B, and C. What do you think the emergency is? Know about absolute neutrophil counts, treatment of neutropenic fever, how you would work that up and treat it, and ways to prevent tumor lysis. And then I think within the modules themselves, it might give you, let me go into Blackboard, I'm on the wrong class. There. I know some of the modules had said there are this many questions on this, there are this many questions on that had been in here from before. It might be later on. Okay, there's a little bit more of a test breakdown within on the module 4 as far as how many questions in whatever for at least the 1 and 2. And then, like I said, the module 3 with the diabetes is a total of 25 questions. So it gives you an idea what we're looking at as far as the test is concerned. Any questions from that perspective? Okay, so the next item is, if I can get to the right thing here, this whole manuscript. You probably have read through this. Hopefully you already have ideas in mind. But what I'm looking for the stage 0, which is due next week, is I'd like to know what your topic is, what you're gonna look at, what you're gonna write about, and an idea of what journal you think you might wanna try to submit to. We can then go back and forth and discuss it as far as trying to either, depending where it is, narrow down your topic, maybe there's a better journal, etc. But that's not, pick something that you have interest in, because you're going to spend a bunch of time on this, and pick something that, or like think around to your colleagues that may be something of either something a little bit newer or something that people don't typically understand or that they need explained a little bit better. Certain patient population that you think, you know, people need more help with, or some type of topic along that line. But again, pick something you're somewhat familiar with, that you at least know where to start, and that you think would be of interest to readers in general. The stage 1 is basically what they call a query letter. They pretty much laid it out here pretty nicely as far as what goes into the query letter. Whether in the end you choose, first of all, your journal may or may not say whether or not they want query letters or not. And whether or not you send it or not is going to be completely up to you. But it is a graded piece of things. Obviously not a huge part. It's only about 1 page. Keep in mind that, you know, you're not writing the manuscript in here. You're just giving a summary to an editor on what you want to talk about. You want to keep it short and concise, or they see a 2-3 page letter, they're not going to read it. These are busy people. So, but try to put, you know, look to put that together. Does need to be formally written. So, you know, obviously spellings and, you know, all that kind of stuff that you would normally see. You want to make sure is there. In 742, you're going to do a lot of your research. So originally there were 5 stages to this project, and I got rid of the stage that actually came in here between 1 and 2 because it said about writing the abstract. And I have never written a paper for which I wrote the abstract first. Like, you typically write your paper and then your abstract is, you know, a concise discussion of what you wrote about. So I got rid of that part. But we're looking in 742, you're going to basically come up with an outline, and then you're going to do your lit search, and you're going to start writing some of it. And then the final manuscript will be due in 744. Obviously becomes, as you move through here, a larger part of your grade. And, you know, then you'll have the formal manuscript put together. They are, in general, when you're typing them out, I think she had in here, but you're talking maybe 10 pages typed. But again, it's going to depend on the publication. Many times online, the various publications will tell you like a maximum number of words. They'll give you guidelines, and what we're looking for as far as, like, normally in nursing, we write in APA format, but they may tell you to use another format. They may tell you that you're supposed to set tables up in a certain way, or you're supposed to limit the number of words, or you're supposed to have headings in a certain way. We want you to follow that, so that the idea is that if in the end you choose to submit this for publication, that it is following their basic guidelines. And this is a very typical project, at least that it's done in acute care, because pretty much the FNPs, we were talking about it, and they said, well, we took that out. They don't typically do that. And I polled like all my coworkers who are acute care certified, and every one of us had to do something like this. So at this point, well, for you guys, we will leave it in. Moving forward, nobody's going to change this in the middle of your 3 semesters from that perspective. Any questions or any comments as far as what you need to do, at least for this semester, with the topic, the journal, and the query letter?
I do have a question.
Shoot.
So when we pick a topic, are we just literally talking about a topic like generally, or are we talking about a problem that we're noticing that should be focused on in practice, or like an intervention that should be like, because I'm trying to think of a topic, but I feel like it's so, like, I don't know if I'm supposed to be more general or if I'm supposed to like talk about something really specific. Like, I don't know if that makes sense, but
it does make sense, and I think it depends a little bit on the journal that you pick. So I'm trying to think of a good, okay, this topic has probably been overpublished and overused, but it's the one that comes to mind off the top of my head. Talking about goal-directed medical therapy in systolic heart failure. You know, you could talk about it in general. You could get very specific on, you could narrow it down to doing a paper on beta blockers in heart failure, or maybe related to heart failure. One of the SGLT2s, the Farxiga, et cetera, is now indicated in heart failure patients, but it's also indicated like whether or not they have diabetes. Well, that's sort of new information, and that not everybody knows about, that not every NP knows about, that not every nurse knows about. So maybe you'd want to submit a paper in talking about that and what the evidence behind that is, would be an example. And then I'd start looking at the other thing on how specific to be would be depending on the journal. So if you're submitting to you want to pick a journal that is, you want to know your audience. So is this a journal that's read mostly by like nurses? Is this a journal that's read mostly by like nurse practitioners, PAs? Is this a journal that's read by physicians? And you're probably not submitting to a journal that's mostly read by physicians, would be my guess, but I'm not saying you don't, depending on what your expertise is. But if you're writing like to RNs, to floor nurses, the way that you write might be a little bit different, or the complexity that you write might be a little different than if you're writing to nurse practitioners. And are you writing like about the use of, I'm going to use the first SIGA just because that's what came to mind. Are you writing to a journal that would be like to family practice NPs who might see it and like be like, why is my non-diabetic patient on this drug? Or are you writing to heart failure nurse practitioners for which it might be written differently? Or are you writing to general hospitalists? So what journal you choose will probably influence, because that's going to be your audience, it's going to influence how you might write up the paper. Does that make sense?
Yes, it makes sense.
Yeah. I throw out some ideas. You can shoot them to me in email. And really what's next week, like shoot an idea, because that's just a starting point for our conversation to finally come up with a final topic.
Okay.
So, well, I'm really interested in, whatever system, whatever problem, whatever diagnosis, whatever drug, whatever, and then we can sort of discuss how that might turn into some type of article.
Okay.
Okay. So Friday, September 24th is our in-person day. Like I said, we're still putting it together, but to give you a general idea what it's going to look like, they call the standard patient experiences, but basically PA College has these people come in, they're actors, a lot of them are nurses, and they write up a situation and these people act it out. So I can tell you there are going to be two of these experiences where you interact with this person. You're the nurse practitioner, they're the patient, and have this interaction with them. One is going to be a patient with chest pain. You have to, talk to them, evaluate it. You may be given some information, an EKG, maybe some lab work, and then you need to tell them what the plan's going to be. You have 25 minutes to basically do your history and physical, do your assessment of the patient, tell the patient what the plan is. So they asked me on setting, it's going to be like an ER. So you're called to the ER to see this patient, to admit him for chest pain. Here's your information, go in and talk to him, tell him what the plan is. You'll then be given a couple minutes to sort of get your thoughts together, etc. And then you will have 15 minutes to present the patient to either myself or to Maria Leach. Like you would present to one of the docs, or you would present to your preceptor. And there's information in here on what we're looking at grading wise for both the interaction and also for the presentation. And then either sometime during the course of the day, depending on how much time you have with the other things that are planned, or that evening, we want you to write up and submit a history and physical. And I'm thinking about this now. I'll probably give like a day or two after that to get it in, just in case somebody has to work that evening or something along that line. There will be a second patient experience, which is going, at this point, it looks like we call it breaking bad news, but it's probably going to be a lung cancer patient, since that is discussed in lung cancer is one of the things that we discuss in this class. And basically, this patient's got a tumor that looks like it's lung cancer. How are you, you've got to go in and tell the patient your CAT scan showed this tumor. This is what we want to do about it. Deal with their fears, their issues, however they respond to this news. And And then that patient, we will have at the end of the day, we'll have some discussion about. Maria Leach currently works in palliative care. So she's gonna give a little bit of tips on how this might work best to break bad news. What'd you feel? What'd the patient feel? And there is actually, most of us just sort of wing it, but there is actually standards as far as like what the best practice is sometimes to do this stuff. We're going to have some modules where some of them are going to be on your own, some reading some EKGs, looking at pulmonary function tests, looking at chest x-rays. I wanted to do a heart sounds. And basically you'll sort of self-pace through those, and we'll go over the EKGs, we'll go over the answers at the end. They're not graded in any way. It's just to give yourself practice looking at those things. We'll discuss those. We're going to work with family practice on some of these. I am looking to do a module where, because these are skills that acute care NPs are supposed to have, on temporary pacemakers, transcutaneous pacing, defibrillation, and cardioversion. So for those of you who have ACLS and do it, or are ICU nurses, that's not going to be difficult, and you'll be boom, boom, boom. But there are some people who do not come from an ICU background or a cardiac background and haven't like touched any of those things. So a lot of, not so much the skills, but like, when would you want to cardiovert somebody? When do you want to defibrillate somebody? That kind of thing. And then some basics on how you do that. So that if you get into that situation in the ICU, at least you have some idea. And like I said, some people will go through really quickly because that's what they do every day as a nurse. So those are what we're looking. We haven't finalized all those stations yet and how that would flow. But the SPs are pretty much set, and that's what you would pretty much expect. I'm looking at trying to do 8 to 4:30. We may get, the hope would be we get out earlier, but I'm not sure. There will be an hour for lunch, and or try to write up your H&P, whatever you decide to do with that time. Go from there. Looking ahead, just to give you an idea, looking at doing skills in the spring, central line placement, A-line placement, intubation are the 3 biggies. And I typically have some acute care NPs from the hospital and elsewhere come over and that do them all the time, and we work with that. We learned last time, we'll do some gowning, gloving, that sterile stuff that as a nurse, but sometimes when you're the one who has to, completely gown up in order to put in the line, etc., it doesn't always flow the way as easily as you'd like it to. And then I think the last summer, that's not set yet, but probably looking at like doing some high level simulations, like shock and treatment of shock and those kinds of things, maybe some trauma stuff. That hasn't been set exactly. So that's what we're looking at there. Any question about 740 at this point? Okay, so for 741, I think I walked through that video on how to use Typhon. If anybody has issues or problems with Typhon, reach out to me. We can go through it, or we can do a Zoom and I can walk you through some of it. Big things are basically 3 things that ended up going into Typhon this semester. You need to start your portfolio. It lays out in the syllabus what things need to be in there, but pretty much that front page with who you are, your resume. I would suggest towards the end of the semester that you put in just a synopsis of what you did in your clinical. I did clinical with a hospitalist. I saw these types of patients. I saw this many patients per day. Just giving some ideas of what kinds of things you managed. during that time, whatever that setting may be. So that goes in the portfolio. There is the time log where you put in how many hours you have each day. And in conjunction with that is that paper clinical time log. Because when you put your time log in Typhon, I've got to trust, and this is more for accreditation, I've got to trust on your honor that you were actually there for 10 hours or 12 hours. Like, I have no way of knowing if you were there that particular day. And so they wanted some way that basically your preceptor just signs off on that time log, or whoever was precepting you, it may not be the same person, that you were there that day for X number of hours. I would have whoever your primary preceptor is, if you've got more than one, or somebody substituting in and out, I would have the primary person be the person to sign the bottom of the sheet. Those are due mid-semester and then at the end. So we could just, and the goal would be about week 6 to 7, you should be about halfway through your hours. I know not all of you have the same hour commitments if you're a postmaster student. So, and I think everybody knows what their requirement is from that perspective. Patients into Typhon, please try to enter. I would expect there'd be at minimum 3 to 5 patients per day on the rotations that everybody's on now. When you get to the ICU, there may be, there could be days that there are less, like if you're really involved with a really sick patient and that's where you've spent your entire day. But for the most part, at minimum, there should be 3 to 5. And it isn't all just patients that you personally wrote a note on. Like if you rounded with the team, if you rounded with your preceptor on somebody that you were involved with discussing, then put that patient in. You don't have to put a lot of details in for them. And then of course, every 2 weeks, you've got a graded note that goes in. We're asking that you put the SOAP note in Typhon, but that you also then just copy and paste it onto a Word document and email it to either myself or Maria, whoever you're assigned to, because in Typhon, we get this little box that we can make comments on, but I can't make comments like on the actual note to be most constructive. So you don't really, it's hard to follow. So this way with the Word document, we can, in red or purple or whatever, make comments and then send it back to you so you have some feedback on your notes. That's pretty much it there. Midterm and final site visits and evaluations. Your preceptor will need to do a midterm and a final evaluation of you. Those are located in Typhon, and they would have received instructions on how to do that from Megan Ryder at the college. And she sends them logons on how to log into Typhon and how to do the evaluations. That's the most important part for them to do. And again, their midterm and final. Maria or I will either see you at the clinical site, or we will do a Zoom with you and your preceptor, depending what works out best for everybody. I know those people at LGH, I am likely to see you there just because I'm physically there about 50% of my work time. But I'm not sure what Maria is going to set up for that perspective. And if for some reason it doesn't click with our schedules, we can Zoom as well. And that will, typically, unless there's a problem, we would physically try to see you once during the semester, sometimes usually around the midterm, so that if there are any issues, we can head them off before they become big issues. And then check in with your preceptor at the end. Sometimes that's via email, via Zoom, via phone, any issues, etc., and go from there. Any questions by anybody about clinical?
I have a question.
Shoot.
About when we submit the our notes for grading. So when it comes like getting the notes from, I don't know what platform you guys use. We use Epic at Reading.
Right.
getting the note from Epic to Typhon, are we supposed to like copy and paste it? Because the format that I use, like puts the patient's lab values and like all that stuff in the note too. So I don't know if we're supposed to use the whole entire note, or are we supposed to like retype it into like, I'm not really sure, because I had one from last week that I wanted to submit, but I'm not sure like how I'm allowed to or how I'm supposed to do it to get it into Typhon.
Okay. So I'm not sure I know 100% of the answer for you. I could probably ask a student from last year. I know that notes that I read last year many times had like test results in them, CAT scan results, lab results, etc. And I doubt that they would have hand typed those in, because sometimes they were like, 4, 5, 6 sentences of a CAT scan report. So I'm guessing they were copy and pasted in. Whether you can do that straight out of Epic straight into Typhon, you're gonna have to play with that a little bit. Some of it might have to be retyped. What I would say is if you do copy and paste, absolutely make sure that you don't have identifiers in there. So if you want to like get their name out, their MRN, you can use initials, you could say Mr. X, substitute that out, whatever, but you definitely, neither of us should be able to identify what patient that is or figure that out. But I don't know if it copies and pastes. I mean, a lot of students did time at LGH, which is also Epic. And I had some pretty detailed notes that looked to me like, including the lab work, like it would have been copied and pasted, but I can't tell you exactly for sure that it was.
Okay.
And you might have to play with formatting a little bit.
Okay. Now, along with that, with Epic, my other question is, because I had a really good note last week that me and my preceptor went through, and she was like giving me critiques and whatever. And if I wanted to go back into the patient's chart to get that note, even though they're not in the hospital anymore, is that frowned upon because I'm not caring for them right now, or because you're a student and you need it for like grading purposes? Is that okay? Like, I'm not sure what is like hairy when it comes to like student chart access and stuff.
I would suggest checking with your preceptor, because every facility is different.
Okay.
And what they allow.
Okay.
And I would probably also, I would maybe check with your preceptor before you copy and paste the note to make sure that it's not something the facility would have an issue with, even if like you're removing identifiers.
Yeah, she told me there's a way, like she told me that you can print notes, like if needed, which I'm guessing would have their identifying information on it. So I wouldn't want to do that, but yeah, I wasn't sure, because I was going to try to do it last week, but I wasn't sure if I should have like copied and pasted it into like Typhon or like into my email and so I have it and then submit it, but just like remove the patient's identifying information. I'm not sure. I'll have to see.
I mean, you're gonna have to play with it. You should, like, you can pull Typhon up in any computer that has internet access.
Yeah.
So you might be able to pull them up side by side and do it right away. And you can always like start the patient in Typhon and and then like clean it up and finish it at home.
Yeah.
And that would be, that would be a possibility. Yeah, I wish I could be more specific because I haven't tried it, but you'll just have to play with it a little bit and see, because there's so many different computer systems depending where students are. They may copy and paste nicely, they may not. I'd be a little careful about printing notes and taking them home with you. Because I didn't fires. That's
I didn't really want to do that because I'm like, I don't think there's a way for me to take like the patient's information off of it if I print it out. That's why I would rather copy and paste, because then I can copy what I want out of it,
Right.
and not take like all of the information with me.
Right. Well, and I'm thinking, I mean, from Epic, like with the stuff I have, I think like your HP, the stuff you type out, like your assessment and plan probably will copy and paste just fine.
Mhm.
I'm not sure about like physical exam and like the review of systems where you just click buttons
Mhm.
and then it prints it out. I don't know how well that'll copy and paste, but again, you'll just have to try it. And if not, yeah, and I, at least I can say for me, like if you're doing an H&P, I would like to see the H&P like you would do for the clinical area.
Yeah.
Like, I don't want a health assessment H&P of every last blessed thing that I'm pretty sure you didn't do. You know, like we don't look in everybody's eyes, their ears, their mouth, their nose, their, you know, the whole 9 yards for the complaints of I've got cellulitis in my toe. So I'm looking for the notes that are pertinent and what you would do in the clinical area. Not like you were writing it up for health assessment class. Does that make sense?
Yeah, that makes sense.
And it'll save you time. Mostly history and physicals, consults, or your regular rounding note. Later on, we might, like somebody might do a discharge summary here and there, but I don't routinely do them because they don't typically involve like a physical assessment and that kind of thing. But your routine rounding note and H&P consult would be appropriate notes for grading.
Okay.
Okay. Anybody else got any other questions? Questions, concerns, complaints?
I feel like I have another question, but I don't want to keep asking if they don't have any questions.
No, you may keep asking.
Okay, well, I'm going to ask my next question because you kind of touched on, I was going to ask about like procedures and stuff. And then you said about in the spring with like central line, A-line, that type of stuff. Only because my preceptor asked me last week and I wasn't sure. And I don't think I'm going to do this with hospitalists anyway, but what about like suturing or what am I trying to say? Numbing before you suture. My mind's not thinking of the correct word right now, but like, do we go over suturing and stuff in school, or is that something?
Yeah, so we did suturing. So last year, because of COVID, the only in-person day they had was in the summer. And we did suturing in the morning, and then we did the line placement and intubation in the afternoon. We did the suturing with the FNP students. And my hope is to do that same format, but bring it to the spring. As far as procedures are concerned, obviously you haven't had the teaching for it. But if you have the opportunity in the clinical site and your preceptor is willing to teach you, you can give it a shot. That's completely between you and your preceptor. Hey, they make a lot of noise. But that's between you and your preceptor. So it's just like a couple people, by the time we got to the didactic and central line placement, they had done their ICU rotation and they had done 1 or 2 during their ICU rotation. So that's between you and your preceptor. If they're willing to teach you and, you know, help you and watch you, you know, that's really not a problem for you to do it.
Okay, that makes sense.
So, you know, because you might end up in a scenario where you have the opportunity, and I will, you know, they don't come frequently. So I'd want you to take the opportunities that you have.
Okay.
Anything else on your list?
Let me think. We talked about Typhon, the note submission, which I wanted to ask about. I can't think of anything else that I really had like pressing that I wanted to ask. I'm going to email you about my topic, because
Okay.
I do have something in mind. It's not something I'm like totally in love with, but it's a glaring subject that is kind of like very evident in all
Okay.
of the patients that I've been taking care of. So I'm going to email you about that, just to see kind of what you're thinking, to kind of help me out a little bit, but I
Okay.
don't really have anything else that I can think of that I wanted to ask you about.
Okay. Rachel,